Thank you. All right. Well, thank you for joining us today for MVC's Health and Action Work Group, focusing on the MVC Common Conditions Report. My name is Emily, and I am one of the site coordinators with MVC. It's my pleasure to be not only facilitating, but also presenting this work group for you today. So before we get started, just wanted to review a couple of housekeeping items as we usually do. First, this session is actually going to be recorded today. I'm going to be using blinded versions of our report and registry data. And so unlike the last time we did a push report review like this, we're actually going to be able to provide a full recording of everything so you can go back and reference it later. We're hoping this is going to be something that we can continue to do in the future and will be a good resource for you. Second, a reminder to just please double check that your mic is muted throughout the presentation. Of course, if you have a question or if you want to partake in the discussion at the end of my presentation, you're welcome to unmute yourselves then. This just helps reduce background noise and give us a better recording for your reference in the future. And finally, we're going to be monitoring the chat throughout the presentation. So if something kind of comes up as I'm speaking, feel free to pop that into the chat and we will get to your questions at the end of the presentation. For those attending this work group for P4P credit, we're looking forward to your active participation. I do have a couple of very brief polls throughout the presentation, just give me an idea of who's in the room. And then, of course, hopefully some discussion at the end of the presentation. And then additionally, at the end of the full work group, we will be sharing that post work group survey. And as always, to receive credit for your attendance today, please complete that survey and indicate the site that you are attending on behalf of or whom you will like your attendance credit to be credited to. All right. So as I mentioned before, I will be hosting today's work group presentation. I have been with MVC for about a year and a half now. I think the last time I gave a presentation, I was exactly at my 1 year mark. So that's pretty exciting. Prior to my role here as a site engagement coordinator, I worked for about 6 years as a registered dietitian. And so I'm coming to you with a little bit of a clinical background. All right. It's my pleasure to begin leading you on an exploration of MVC's most recent common conditions push report with a coordinated MVC data registry tour to follow. Our agenda today will first be to just introduce our common conditions push report. We'll review some of the details and conditions included in the report, as well as the various metrics. We'll then follow that up with a registry tour in which I hope to show you in a little bit more detail how we can push into the registry to supplement the information provided in the Common Conditions Push Report. And for anyone who's joining us today that's like, what's the registry? How do I access that? I will provide you with just a quick summary of how to request registry access and our process for that. And then we'll end with discussion and questions. All right. So before I begin, though, I do want to just start one quick poll. And this is just to identify how many folks joining us today have reviewed your sites or potentially multiple sites if you're from a system, your common conditions push report, which was shared in July. Maybe just a couple more seconds to respond. Still seeing some responses coming through. Okay, so it looks like the vast majority of folks joining today have seen their site's common conditions report. And then a couple others either don't have access or are not sure if they've seen this report. So hopefully, as I can, move forward and continue to review it, it might become more familiar to you. If you do not have access to this report, but think you should, please connect with us at the end of the work group or via email, and we will work towards getting you access to this because we think it can be a really great resource. Okay. All right. So, some of you may be aware of other previous MVC push reports. We've traditionally focused in the past on reports focusing on one condition, surgery, or metric kind of at a time. But MVC is really moving towards reports that pull together multiple conditions, surgeries, and that is very true of our common conditions report. The most recent one being shared, like I mentioned, in July of 2025. But a version of the Common Conditions Report was previously shared in June of 2024 and October of 2023. The Common Conditions Report was developed to help our members evaluate their performance and identify areas of opportunity within common hospital conditions and procedures through an individualized, comprehensive, and actionable insights for eligible measures. The report covers a 2-year time frame and is in alignment with MVC's overall focus on quality of care. Ultimately, MVC's intention is to place a greater emphasis on evaluating the quality of value-based care versus cost-related measures. However, this report actually provides sort of a combination of evaluations of episode spending as well as healthcare utilization metrics. So the Common Conditions Report includes several conditions listed here, many of which are likely familiar to you as they sort of align with a lot of other MVC reports as well as our P4P metrics. I wanted to specifically note that while this report includes some conditions that overlap with our P4P metric, it also contains a few that do not appear in those metrics, but have been shown to be of interest to our membership. Most notably, in the most recent Common Conditions report shared in July in comparison to June of 2024 and October of 2023, we incorporated atrial fibrillation as a common condition and removed joint replacement. And that was a decision made by our team, somewhat due to aligning with modifications to MVC's P4P metric selections. So we hope that you find some additional information on AFib interesting. And we maintained all of these other conditions from COPD and CHF to CABG, PCI, pneumonia, sepsis, and colectomy, non-cancerous colectomies. So to create this push report, MVC pulled claims data from several payers, including those listed here. These are kind of MVC's standard payer selections. And the process measures report includes 30-day inpatient or surgical episodes created from index admissions between January 2023 and December of 2024 for most payers. Noting that the data for Q3 and Q4 of 2024 is not included for Medicare fee-for-service. This report excluded patients who had an inpatient hospital transfer, died in the hospital during their index hospitalization, or were discharged or transferred to hospice during that index hospitalization. Throughout the report, you'll see that sites are compared to your region and MVC all. Your region reflects sites within an MVC defined kind of region of Michigan. So, for example, hospitals that are located in the southeast versus the west side or the northern portions of the state. If you're interested in what other sites are included in your region, we can link you to that region, those region lists. They are available on our website. The MVC all comparison reflects averages amongst all MVC member hospitals, which were eligible to produce a value for a given metric. And then if you're joining us from a critical access hospital and have access to the critical access hospital version of the common conditions report, you'll note that your comparison group is other critical access member hospitals. And if you're interested in which sites from MVC are incorporated in that grouping, we're also happy to share that with you. Okay. So the next few slides, I'm going to review the various components of the Common Conditions Push report. I am using a blinded version of the report to just orient you to the content breadth of the report. So I'm not focusing on any one particular hospital site. We've already reviewed the content of the cover page, so that included information on the history of this report, the goals, and some of those report details that I outlined. So next, I'm going to take a look at the patient population overview table. Okay, so each site's common conditions report is going to include one of these patient population summary tables. It's just a quick way to evaluate which common conditions your site was eligible to have included in this report. And by that, I mean kind of the following individual common condition pages. To have one of those pages included for AFib, COPD, and other conditions, your site did need to have at least 11 episodes of care within that condition. The population reflected in this table includes all episodes eligible for this report for each condition cohort. It's intended to illustrate the distribution pattern of the population within each of those conditions, but is not necessarily indicative of the distribution of patient demographics for the outcome of interest. So each cell contents within this table represent the column percentages of each subcategory within the population for each specific condition cohort. However, the race and ethnicity denominator does include all patients. It might not necessarily add up to 100% due to the exclusion of other race ethnicity categories. We included in this patient population snapshot a metric called the DCI, or the Distressed Communities Index. We use patient zip codes categorized as prosperous, comfortable, mid-tier, at-risk, or distressed, according to the Economic Innovation Group's Distressed Communities Index, or DCI. This DCI incorporates economic indicators of the general population, such as education status, employment status, and income. The incorporation of measures like age and gender, race, ethnicity, dual eligibility, and DCI in this table reflect a small step by MVC to incorporate sociodemographic information into our analyses to help deepen your understanding of your patient and community needs and further support your quality improvement efforts. Okay. So for each eligible common condition, the subsequent report pages in the common conditions report will include a variety of uh, graphics. Each page follows a really similar pattern. So the next couple of slides are going to walk you through examples of each of those metrics. Specifically, I'm just going to look at AFib for this kind of walkthrough, but keeping in mind that these metrics are analyzed for each eligible common condition on each subsequent page of the report. So starting with a 6-month trend chart comparing 30-day total episode payments for each common condition. You can see here that within this chart, you'll have a comparison to your region as well as the MVC all average. Of note, data points here are shown in 6-month intervals. If you're looking at your report and you notice that there is a data point missing, that would indicate that there were less than 11 episodes for that particular time frame, and so that data point would be excluded from the analysis. And then, as mentioned before, when we're looking at kind of trend charts like this, keeping in mind that those last 2 quarters, so 2024 Q3 and Q4 data, does not include Medicare fee-for-service episodes. Okay. Each report also includes a breakdown of 30-day total post-acute care PAC payments by payer. So this is an example of payer breakdowns for post-acute care services, including LTAC, inpatient rehab, outpatient services, home health, ED utilization, SNF, and outpatient rehab for AFib. Gives you kind of a perspective on which services may be dominating that post-acute care payment. In this example, we can see that for most payers, outpatient services dominates the total post-acute care payment, but SNFs primarily dominate for patients that are dual eligible. So just kind of a nice visual to identify some potential areas of interest related to post-acute care episode spending. Of note here, you're only going to see information on this graphic for payer categories that have at least 11 episodes during the 2-year reporting period. So if you notice that a particular payer is missing, it may be that there were just limited episodes of care associated with that payer for this particular condition. And then additionally, I'm looking at this one and sort of up at the top for BCBSM, BCN commercial, for example. You see that there's a darker blue section indicating SNF. And if they do not have a percentage noted, then that indicates it's less than 9% of the total. Okay. The next 2 components of the report focus on 30-day healthcare utilization rates. So sort of transitioning from episode payment analyses to healthcare utilization. The first that I'm showing here is the rate of post-acute care utilization stratified by the type of post-acute care services. And similar to some of the previous graphs compared to your region and MVC all. This portion of the report can provide insight into variances in post-acute care service utilization. For example, the largest variation we're kind of seeing here is in outpatient services between the hospital, the region, and MVC all. So that might be an opportunity to evaluate, for this particular site, outpatient service optimization, especially since it also appears to dominate post-acute care spending. All right. Additionally, each report includes an analysis of the rate of post-discharge ED utilization over 6-month intervals compared to your region and MVC all, and a 6-month trend in 30-day readmission rates. And lastly, each report includes a analysis of the common reasons for readmissions based on DRGs and provides information on the percentage of readmissions attributed to that common reason. Of note, if you notice that the uh, kind of percent of readmissions is tied for multiple DRGs, the codes are just displayed in a numeric order. Okay. So that is kind of a walkthrough of the Common Conditions Report and the various components of each page that you'll see in that report. But you're probably thinking, like, couldn't we dive a little bit deeper into this? And that's what I'm hoping that we can do next. By taking a look at some registry report pages. So you may or may not be aware, since we've been kind of focusing on multi-payer reports in MVC's registry lately, but there are several other single payer reports that could be helpful in further evaluating the results of these common condition reports, providing you with a little bit more deeper understanding of what is going on here at your site. So these could include reports like our episode payments report, episode utilization rates report, readmissions report, and many more. So our next step is to take a tour through actually our training registry website, which some of you might have seen during our registry review with me. Others have been able to utilize their own sites registry for those reviews. So one thing I did want to call out for this is that our training website is a little bit more static than our live registry, which you have access to. And for that reason, the time frame of episodes that are included is not going to match up with what you're able to see on the registry today. For example, I think the latest index episode included in our training website is from like early 2024. So I'm not going to do direct comparisons to the push report. We're just going to use this more as a review of the capabilities of these various reports in the registry. So while I'm getting set up for that, we're just going to pop up another quick poll here to get a sense of how comfortable those of you on the call are with the data registry. Bear with me while I pull that poll up really quick. And I want you to do that. Thank you for bearing with me while I got that all loaded up. As you can imagine, it's lots of different password logins and everything. Um, Looking at our poll, it looks like okay, kind of split 50-50 between folks that somewhat agree with the statement that they're comfortable navigating the registry, and then the other 50% feeling like they kind of disagree with that or are on the fence. And then a few of you that do not have access. I'm not sure if it's the same for who don't have access to the push reports, but definitely connect with us at the end, and we will work towards amending that. Okay, get that poll out of the way here. Okay, so hopefully all of you can see our training registry. Right now, we're currently on the cardiac rehab utilization multi-payer report, which is what I'm not actually going to be focusing on today. Um, Pull up some of my notes here. Okay. So what I wanted to sort of show you was thinking about the various kind of reports that were included in the push report we just covered. Where are some areas in the data registry where we could push into that information a little bit or modify it in some way to give you a slightly different picture on the data that was included in the push report? So, thinking about that very first metric that we were provided in the push report. We were looking at trends over time and total episode payments for a particular condition. Where I might want to go to take a look at that a little bit closer would be within one of our single payer reports. Our report selections within the BCBSM, Medicare, and Medicaid report collections are they mimic each other. So it's exactly the same type of report, just differs in which payer's data is getting pulled into those reports. Okay. So I'm going to stick with BCBSM data today. One, to just keep it easy so I'm not like, moving between lots of different payers, but also because our BCBSM reports also allow you to drill further down into the data due to our data use agreements. And we can actually take a look at how you can get into some patient level data as well, which I think, is something that we can't provide in a push report. All right. So for total episode payments, I'm going to look at our episode payments report within the BCBSM report collection. Um, Keeping in mind that these are not real hospitals in this training site. It's just an amalgamation of various types of sites. So we're working with Bayside Medical Center. It sounds like someplace out of California. Um, and what we're looking at here currently is episode payments, episode payment breakdown for all service lines, all conditions. We could specify that to a particular condition. Because I've already focused on AFib today, we're just going to stick with AFib. And then we can also modify the date range. So within the push report, we were working with a 2-year time frame. In the registry, you can look at a really large time frame if you'd like, all the way back to 2015, if that's of interest to you. Today, I think we're just going to leave it where it's at program to date so we can see lots of trends over time, but just keeping in mind you could modify that. Within this report, we can drill down into various aspects of that total episode payment, from facility index total payment components to professional payment components. And this table gets really big after a bit. We also have a readmission payment, which is just kind of one kind of component in itself. And then post-discharge payment components, which you might be thinking, hey, there's some more information maybe there that could support that second graphic in the push report, which gave us some information on the total post-acute care payments divided up by payer for inpatient, outpatient rehab, SNF, ED, home health, LTAC, for example. Okay. So this is sort of one place that we could go to dig into what may be modifying those total episode payments over time for a particular condition. If there was one particular area of interest, and since the push report kind of focused in on post-discharge payments, that's where I'm going to go. We can look here at specific dollars for compared between a site and MVC all, and look for areas of opportunity. So what I'm looking for are payments that might be slightly higher than that MVC all average, to see if that may be an area where we could kind of push in and take a look a little bit deeper. So I'm noticing that SNF payments, for example, are a little bit higher for Bayside Medical than the MVC all average. So let's take a look at that. If I press into that SNF payment component of the report, I'm going to get an entirely different graphic display at the top of that report, reflecting changes over time for that particular episode payment component. Things that you can do within these graphics then would be to investigate a particular time frame within your specified episode date range. So if we were specifically interested in, what happened in 2020, we could probably guess what happened in 2020. But let's say the COVID pandemic didn't happen and we weren't sure. We could select that data point, and up above these graphics, we're going to have even more information. So we have, for example, information on our adjusted versus unadjusted payments. We have our odds ratios. We have confidence intervals. And then we have this detail portion, which provides us with a link to the data points that were incorporated in this metric. And if we press into that, you'll notice it's hyperlinked. This is how we can push into more patient level data within the registry and actually filter within this section of the report by things like admission date, discharge date, length of stay, and then those various payment components to see if we can identify, what was unique about various episodes of care that might have increased that particular SNF episode. Okay. All right. Just moving forward, we've kind of covered those first two portions of the Common Conditions Push Report with this episode payments report, just to kind of summarize some different things that you can do here. For one, you can look at way more conditions than we included in the push report. You can modify the date range. You can also modify the episode length. The push report specifically looks at 30-day episodes. If you were interested in taking that out a little bit further to a 90-day episode, for example, you can do that within this report by modifying that episode length. Okay. We can also evaluate in detail more of the payment components of that total episode payment total, and we can drill down into patient level data. Okay. So the next couple of components of the report were focused more on healthcare utilization. And so the next report within the data registry that might be helpful for drilling down into that would be the episode utilization rates report. So I'm going to look into that one. One nice thing that the registry does is when you are moving between reports within a particular collection, if you've selected a specific service line and or a condition, it will maintain that service line and condition as you move through different reports. You don't have to continue to reselect AFib if that's the condition that you're specifically interested in evaluating. All right. So within this report, we have a lot of the same filters. Once again, we can adjust that episode length, the episode date range for index admissions that are being included. We have a pretty similar setup in terms of the various graphics at the top. But within the kind of base of the report, a couple of things that we can look at is just overall readmission rate. And then we can drill down into rates of post-discharge healthcare utilization. So sort of similar to what was included in the push report. We can distinguish between inpatient and outpatient rehab utilization, SNF utilization, home health, ED utilization, outpatient, and LTAC. But in addition to that, we can push into each of these areas and look at the specific episodes incorporated within these various sections. Okay. Can also look at a wider date range and look into those specific points in time that are maybe suspicious or interesting to us. Keeping in mind that you might also want to look at cases that are not necessarily, pulling your utilization down or utilization up, depending on, what your overall goal is. Right. One thing to note is that one of the other aspects of the push report was looking at post-discharge ED utilization, and that is incorporated in these post-discharge rates. Okay. Last report that I wanted to show you was our readmissions report. So very similar setup to before, but within the readmissions report on the registry, we can look a little bit closer at specific readmission intervals. So you can take a look at not only was there a readmission within 30 days, but did that readmission occur within the first 4 days post-discharge, the first week, the first 2 weeks, or the first 30, and see how those rates may be differing by different service lines and conditions. We can also look at the rate of readmission to your facility as opposed to another facility. This is something that is very unique to MVC's claims data that would be more difficult for you to identify in abstracted clinical data. You're most likely only going to be able to see readmissions that occur at your site. Whereas we're able to pull in some more information for you on if those readmissions are occurring at an outside location. Okay. Great. Those were the primary reports that I wanted to show you within the data registry. So I'm just going to pull up my slides again here. Bear with me. While I'm doing that, were there any questions? It looks like we had a couple come through in the chat while I was talking. Okay, so just kind of taking a pause here. Looks like Emily Narrator liked the payer breakdown that was included in the push report. We can indirectly get some of that information from the registry, but it is definitely nice to have that as a summary in the push report. Um, Kelly wondered if it was possible to separate medical and surgical. It's definitely possible to separate those. I mean, you can look at very specific um, conditions within the registry, and each kind of page within the push report would be specific to, a medical versus a surgical condition. Um, does that sort of answer your question, Kelly, or was there something else you were aiming to get at between separating medical and surgical that I might be missing?
We got a thumbs up
I
from
got a
Jen.
thumbs up. Okay, good. Sorry.
I didn't know if you could see it, so that's why I
No, it's
figured.
really hard for me to see some of those things. I appreciate you letting me know. Okay, and I was just getting my slides up and ready here. I did pull together kind of a summary slide for you to reference later that just kind of summarizes those reports that I walked through and kind of how they connect to the push report. Hopefully that will be helpful for you as you're thinking about how to use it in the future. Um, okay. Terms of what's included in outpatient services from Scott. Stephen, would you be able to contribute to answering that question? I know there's lots of different things that can be included in outpatient services.
If you scroll down, yes, I did answer that.
You did answer it. Great. Right. So Stephen said, just for everyone's awareness, outpatient services can contain 13 different bill type of claims related to the episode. Let's see, and other claims 30 days post-discharge. That could be procedures, E&M visits post-discharge, imaging, tests, labs, DMEs, if that's applicable, anesthesia, and medications. Great. Okay. Let's see. The most recent data that we can get in the registry reports, I'm just calling that out. Thank you, Rachel, for answering this already. Is currently December of yes, for index admissions. Yes, December 31 of 2024 for BCBSM, BCN, and Medicaid, and then index admissions through um, June 30th of 2024 for Medicare fee for service. We are expecting some new data specifically from BCBSM and BCN soon. Just to reiterate, I know we've talked about the data lags several times, but we get Medicaid and Medicare data on more of a quarterly basis, and those tend to have around a 6 to 9 month lag time. Whereas BCBSM, BCN data, we tend to receive on about an every 2 month kind of time frame. Okay, great. I did want to ask one more, I guess not one more. I have a couple of different discussion questions to ask. So kind of keeping in mind the information that we can pull from the Common Conditions Push Report, and then the further information that we can get kind of pushing into those couple of registry reports that I called out. Are there additional questions that you might want to investigate about these conditions as you're kind of thinking about utilizing the registry? Or are there questions that, cannot be answered by the registry currently that you're interested in? Ultimately, what I'd like to better understand is, where are some gaps in our ability to provide information to you, and if there are some ideas from those here today on additional topics, you might find helpful or different metrics that might be helpful related to this report. And you're welcome to type them in or unmute yourself at this point. Another question I had was just generally, how are folks using MVC's push reports right now? Has anyone specifically used the common conditions report to inform, your progress or opportunities, or any particular QI work? Yeah. Okay, Laura. So you said you'd like a little bit more information on cardiac rehab, utilization 90 days following. Okay. Cardiac rehab visit. Okay. Yep. And Catherine, I know you're speaking to the choir about, with our data having a bit of a lag, um, being claims data. Part of that is just the nature of claims data. We're looking at episodes of care out a month to 3 months. So that incurs some lag in collecting that information. And then we're working with our payer, collaborators.
Um, One thing that I would want to ask to kind of dig into that a little bit more, maybe Catherine, is when we're talking about using the MVC data for QA work, how much do folks look at the benchmarking aspect that MVC is able to provide when they're either going to their stakeholders or reviewing what things should be priorities going forward? Just even if people like can do a raise your hand kind of thing so we can just kind of get a sense of how useful that benchmarking piece can be in QI work, or if we're overplaying that.
A couple of
Okay.
thumbs up there, Jessica.
Thank you. Yeah. We talk a lot about the benchmarking aspect, and I want to make sure that when we do that, we're actually meeting a need that people have and not focusing in on something that's irrelevant.
Yeah. Okay. Looks like folks are still, kind of looking for some ways to incorporate push reports in a meaningful way. Also, some just getting kind of like acclimated with the registry. Um, if there is anyone on today, that needs access to the registry, or maybe you're not sure how to reset your password or something like that, just get in touch with me. If you're fairly certain you don't have an account, we do have a process for requesting registry access. I have put our email up on the slides. You can either just email us and request access, or there is a method to do so through our website as well. But honestly, emailing us is entirely fine to do. Um, so once we receive your request, Jessica, Rachel, or I will get in touch with you to just confirm your contact information, and confer with our MVC site coordinators about your request if you're not a site coordinator yourself. And then we will send over a website confidentiality agreement form for you to sign. Once that is signed and returned to us, we will prompt your access request, and create an account for you. We're also happy to, once we create an account, since you've never likely been in there before, to do a one-on-one walkthrough of the data registry. And yes, I can put that email in the chat. Thank you, Jessica.
Hey, Jessica, can you hear me? or Emily?
Yep.
Hey, yeah, this is Scott from Medic Monroe. Just a quick question. I don't know if I'm asking this right, but I'm not really sure how to make a lot of this data actionable, given the fact like if we're a high outlier and send a patient to a SNF,
Okay.
and the only way they can go to a SNF if it's medically necessary and it's authorized, and we go through the whole pre-authorization and approved by the payers. I'm
Mm-hmm.
not sure how to take that to my providers and say we're sending too many patients to a SNF, because obviously they only go to a SNF if it's medically necessary.
Sure. Yeah, no, that entirely makes sense. And we understand obviously utilization is going to happen when utilization needs to happen. I think ultimately the conversations that you're having are a good start. If you see something that seems like an outlier, just having that conversation about, why might that be higher? And if that's justified, it's justified. Ultimately maybe where MVC data could have a little bit more impact for you would be looking at more so like increased utilization of things like follow-up care, cardiac rehab, things like that, and helping you outline, maybe population areas of interest to sort of encourage more utilization of those areas versus less utilization of kind of necessary, resources like SNF. We'd be happy to set up a meeting maybe between our engagement team and our analytics team to maybe walk through some reports with you in a little bit more detail. See if we can identify any potential areas of opportunity.
Yeah, and often where that leads, Scott, is into more of a custom analytics report, especially with some of our sites that do have some outlying data. So that I think sounds like the direction that might need to go.
Mhm.
I mean, and often so we're talking about the push reports, and we're talking about how you can dig into data in the registry to answer some of the questions from your push reports. Sometimes those answers aren't in the registry, and that's where the custom analytics, just for everybody in general, that's where the custom analytics come into play. So we just kind of wanted to take a minute to show people what is there readily available for you to see, and then also think about like what other questions, because in truth, when we get some of the questions that create the custom reports, those end up at some point later on being in a push report. So some of the push reports that you're seeing right now, the metrics and measures that are in those are from custom reports that happened a year or 2 years ago. And maybe that's no longer appropriate, but we want to work with you to figure out what is for the next iteration.
Mhm. Definitely. All right. Just with an eye on time, and it looks like we've answered most of the questions in the chat. If I missed anyone, feel free to hang on. But just wanted to remind everyone that we're in our last quarter of 2025. So we've got 6 work groups left for MVC this year. We've got our cardiac rehab work group in October, which is going to be featuring a panel of sites discussing initiatives to optimize CHF follow-up cardiac rehab utilization. And that's happening on October 14th. And then on October 23rd, we have a health and action work group featuring a presentation by Hurley Medical Center on their food pharmacy. As a dietitian, that's a little near and dear to my heart, so I hope you come. And then, not to be forgotten, the most immediate event that MVC has is our fall collaborative wide meeting on October 10th. That's at VistaTech in Livonia, Michigan. Registration actually closes today. So if you want to attend, please register before the end of the day today. And if you have any questions about that, please let us know. We are also accepting requests for custom reports, site visits, and MVC interviews. Those are all P4P engagement point eligible opportunities by December 30th. So if you have a particular interest in any of those items, please get those requests in. We're accepting them through September 30th if you'd like them completed before the end of 2025. All right. And then if you've got an idea for a presentation, we have a couple of remaining 2025 work groups, literally like two, that we're looking for presenters for. So if you've got a presentation, we'd love to hear from you. We're also actively looking for presenters for 2026. So submit your presentation proposals. We'll include links for all of these things in the follow-up email, which will come out before the end of the day. And we'll go ahead and drop the link for our post work group survey in the chat. I will also include that in the follow-up email. So if you're not able to snag it from the chat right now, that's okay. You've got a little bit of time to complete these. All right. I'm available for any additional questions. Otherwise, I hope you have a good rest of your Thursday.